Hi, I'm Denise Link, and I am a member of the Board of Directors and a fellow of the American Academy of Nurse Practitioners. And I've been asked to do a short presentation on why it's important for us to be advocates, not only for our profession, but for our patients. I have a PhD in nursing. I've been a teacher in a university program. I've been a clinician. I've been a director of a medical clinic, but most of my qualifications for doing this is the work that I've done outside of my job description in the legislature. And I've also run for office. I've run for the state legislature in my state of Arizona. And so I'll begin by giving you just a real short vignette about what got me started in advocacy. And I was a brand new nurse practitioner. I'd only been in practice for about a year. This was in the early 80s. And I came into work one day with a full schedule of patients, and I was booked out 6 weeks. I'm a women's health nurse practitioner, and I was the only women's health provider in that rather large staff model health maintenance organization in my town. And there was a letter on my desk from the state attorney general's office with an advisory opinion. And at that time, nurse practitioners were not codified in statute. We practiced, but as far as the Board of Nursing was concerned, we were nurses and we didn't need an additional credential. So I also didn't have prescribing authority, but I practiced otherwise as a primary care provider for women. And on my desk was this advisory opinion from the Attorney General, and someone had asked, is it within the scope of practice of a registered nurse? So that's what we were, our credential was registered nurse, to do Pap tests. And the advisory opinion said that, yes, it's in the scope of practice of a nurse practitioner to perform a Pap test. It is not within the scope of practice of a nurse practitioner to perform a speculum exam. Now, those of you who know what's involved in doing a Pap test know that it's pretty much impossible to do a Pap test without placing a speculum. And so I came out of my office, ran into one of my colleagues in the hallway, who was also a nurse practitioner. She says, did you see this? And I said, yes. And she said, what are you going to do? I said, well, I have a full schedule of patients and I'm booked out 6 weeks. And I'm not going to cancel all of these women who are waiting to have their annual, their screenings done to screen them for cervical cancer because somebody in the Attorney General's office doesn't know what they're talking about. And at that time, the Attorney General's office, an advisory opinion from the Attorney General had the force of law. So I said, I'm going to be practicing outside of the law for a while till we get this straightened out. And so that's just an example of what happens when people who are in a position of authority and are not informed about what we do as healthcare professionals, and then answer someone's question without really understanding the background and the meaning of the question and what's all involved. So it really is important for us to be involved in advocacy in some fashion. And a lot of it depends on, how much time do you have? If you have just a little bit of time, my best advice is to join your professional organization that has a presence at your state capital. And at the federal level as well. If you can do both, that's even better. But the state is where your license is decided. It's where decisions are made about what is or isn't covered by insurance, and a whole host of other things that we've come to know as the social determinants of health. So it's not only being an advocate for your profession, but for patients also, and the environment in which they're living, or their education, their job opportunities, the purity of their water, are they able to get enough to eat? And all of those things are things that should be of interest to us as nurses. If you've got a little bit more time, then I would encourage you, when you join that organization that has an advocate, to volunteer to be on the policy committee. It probably has a policy committee made up of members that interact with the lobbyist or your advocate that works for your organization and has a presence at the state or the national capital. And then to help them inform our positions about various bills. And you do that and you learn a lot about issues and how to read a bill and how to talk to your legislator. If you have more time, you definitely want to participate in Lobby Day, which is often offered by the state organizations and the federal national organizations, to go with a group to be mentored in meeting with your legislator, and also to learn who your representatives are in the state and at the federal level, the difference between the two offices, and what their positions are on a variety of topics, so that you can either thank them for supporting something that's important that you agree with, or you can ask them to vote in a certain way or support a position on a bill. If you do that much, if you even just know your state and federal representatives, you'll know a lot more than many people know. You'll be way ahead. You can take time to write letters. Your professional organization often will put out a notice about a bill, something that's pending either in Congress or at your state level, and ask you to write a letter in support or against it, depending on what the bill is about. And often they give you a template. Now, you shouldn't take that template and just send it with your name at the bottom of it, but it gives you some ideas of some talking points, and then you craft your own letter. And it really doesn't take that long. And after you've done it a few times, it's pretty easy. Meet with your representative when they're in town if you have more time, okay? Because you get to know them personally. They know you by name. And ask them what are things that they're interested in that you might be able to help them with now or at some point in the future. Be ready to act as a consultant or a source of information on a particular bill. Go to town halls. A lot of representatives, when they're in town, their state and your federal representatives will have meetings with their open meetings where you can go and listen to what they have to say and then ask them questions and listen to other people's questions. Some of these things, if you go to these meetings or you participate in meetings, being there is important because you hear what other people are saying and how they say it. And it gives you some idea at some point in the future that something that you might be able to do, or at least you're informed about the issues. And then meet with your lobbyist if you have even more time to meet with your lobbyist or your advocate that works for your state organization or your federal organization, and talk to them about why we're supporting or we're not supporting a particular position or initiative. And you learn more about the pros and cons. What are the good things about this policy or this proposal, and what are the things that maybe aren't bad, but what could use a little bit of tweaking to make it even better. So these are the things that I suggest that you choose one of those things. And again, it's all about how much time do you think you can spare. And the more time that you have, or the more interest you have, you'll find that as you do this more and more, you'll get more and more involved. And some of you will become very involved, and some of you will remain more or less on the periphery, keeping informed and up to date, but not necessarily actively participating. But I encourage you all to seek out those people in your state that are involved and can help you to become more knowledgeable about the things that may impact our profession, that impact our patients, and impact the quality of life in the communities where we live. Thank you.